aspirin. Chewing an aspirin is never going to cause any harm, and it may save someone's life. And then if you have the ability to take a blood pressure and pulse, if the blood pressure and pulse are normal or elevated, then you give them a drug called a beta blocker.
Wow, this hit differently.
That is when I knew that this was the Lord.
That's a good question.
I figure if I do it, it'll force me to learn it.
Well, that's why I know him.
The Scene with Sean Uy, Behind the Book, featuring today's book.
Folks, thank you once again for stepping into the scene with me, Sean Uy, and today on the show, the book that we're talking about melds together history. It uses history as a conduit to bring about a plethora of information that really isn't out there. So this book is very important. It's very unique. And it's written by such an amazing person. To get today on the show, we are talking about Medicine at Sea, and it's written by none other than Dr. Dickie Hill. Dr. Hill, please welcome to the show. So, Dr. Hill, Medicine at Sea, very, very big book, so much information. But before we dive into the book, I want to ask you a quick question. What were some of the, or what was the inspiration behind you diving deep into the book, you putting pen to paper, and, you know, actually deciding to get Medicine at Sea out there?
Well, probably about 40 years ago, I was contacted by the California Maritime Academy. This is a maritime academy. There's 5 maritime academies in the United States. 4 are state academies, and then the federal academy is Kings Point. It's like West Point, or it's like Annapolis. These are academies. It takes a congressional appointment to get in there, and then when you finish the Maritime Academy, you're either licensed as a merchant marine officer by the United States Coast Guard as either an engineering maritime officer or a deck maritime officer. The engineerings, they run the power plants, they keep the ship going, and the deck department, these are the people that are the navigators and the captains, and they actually drive the ship. So they came to me and they wanted a medical course. They wanted not just a first aid and a CPR class. They wanted a full semester medical course for their engineers, the midshipmen in the fall, and their deck officers in the spring. So I said, well, what book do we use? Well, the Coast Guard has this book put out by the Public Health, and it was called The Ship's Medicine Chest and First Aid Afloat. And this book was a terrible textbook. You know,
Oh, wow.
It'd been there'd always been a textbook for people at sea. Every ship had to have a designated medical officer, whether it was a military ship or a merchant ship. And we're talking about going back hundreds and hundreds of years, even to the day,
Oh, wow.
the times of the Greeks and later the Romans, that a ship had to have a medical officer, because medical care was important, not only for in wartime, but in commercial ships, because people get injured and they get sick, and you know, having a healthy crew is paramount to having a functional ship. So there's always been medicine at sea forever. As soon as ships started going to sea, they had to have some form of medicine with them. So I developed a book for this class at California Maritime Academy based on my training as a physician and as a medical officer in the Navy. I had been a nuclear submarine medical officer. I went to, in fact, the only training in the world in undersea medicine was at Groton, Connecticut, and we were trained to be nuclear submarine medical officers and diving medical officers. We learned how to use a decompression chamber, and we learned basically what could happen at sea, whether it's an injury or an illness. Now, in the American Navy, very, very few ships have doctors. They have extremely well-trained enlisted people, corpsmen, and only the very largest ships would have an actual physician on it. Over 90% of the ships at sea, whether it be a merchant ship or a military ship, is not likely to have a medical officer, a trained physician. The medical officers on the ship would be enlisted people trained in medicine. So the Maritime Academy wanted their officers to have more than just first aid and CPR. So I
Yeah.
started writing the book there, and this was like over 40 years ago. And the book went through a number of different editions until the book we have here. It's almost 500 pages. It's heavily illustrated because I remember early on when I was teaching the class and developing the book, the students would often complain if they turned 2 or 3 pages and there were no pictures, they got
Right.
discouraged. So
Uh-huh.
the book is heavily illustrated. And I found out also that if you're teaching non-medical people medicine, it just doesn't work unless you can make it interesting. And
Right.
so I use history as the vehicle to teach medicine, whether it's abdominal pain, whether it's how to deliver a baby at sea
Yeah.
or in the field, or
Wow.
you know, when's a fever dangerous? What do you
Hmm.
do about fractures, burns, head
Right.
injuries, seizures? It's pretty much everything I've learned in 44 years of medicine condensed in a book and delivered in a more palatable fashion. So you will read the book.
Right.
Very few physicians, even medical students, we do not read textbooks
Hmm.
because they're just not really readable. They're used as reference. This book is designed like the Bible. It starts out in the beginning, and you start with page one. You read all 500 pages, and when you get through with it, you have my concept about medicine in the field. And then if someone gets a burn or a fracture or a head
Hmm.
injury, or you come upon someone that's unconscious, then you go to that part of the book and actually use it as a reference book at that time.
Right. You're actually really right, because if you weren't aware, I'm actually trained. I actually have a degree in physical therapy, so I can sort of relate to what you're saying. Um, it's really odd now that you mention it, because throughout all the ships, boats, and we have a yacht club here in my city, none of them have information like this. You know, no, none of them have people on board who are trained, who are certified. And as a physician who has written this book, why do you think it is like that, Dr. Hill? And being in the Navy with people that aren't trained and everything, and no one's really on the ship. Why is that so?
Well, by law, maritime law has said for hundreds of years that every ship has to have a designated medical officer. Now,
Right.
when I occasionally would go out on merchant ships
Uh-huh.
with American President lines on container ships. The last time I shipped out of Singapore to Kaohsiung, Taiwan, and back. Now,
Mm-hmm.
there's only 22 people on the crew, but
Mm-hmm.
one of those people on the crew has to be designated as a medical officer. Now, in days past, it was often the purser. The purser, because he was responsible for the ship's stores. He was responsible for the ship's medicine chest, what was
Mm-hmm.
in it and how to use it. But often they had almost no training. Sometimes their CPR and first aid training had been done 20 years ago. I got involved
I
early on
see.
in some medical legal cases because of my expertise and my license as a ship surgeon by the United States Coast Guard. And it's kind of frightening that some of these ships, the medical officer was someone that had last had first aid over 20 years ago, and the
Yeah.
medicine chest was not much of a medicine chest. But if you go to countries like Australia and New Zealand and South Africa, they actually grant a license for someone to go offshore in a boat, especially if they're racing offshore. And not
Mm-hmm.
only did each vessel have to have a designated medical officer, the government furnishes them with a medical kit. And interesting enough, the medical kit has drugs like injectable morphine
Oh
and
wow.
injectable Valium, because we know that sometimes these medications, even though they're tightly controlled, they can
Mm-hmm.
save a life and save a limb.
Yeah.
So in South Africa, Australia, New Zealand, you get a license to go offshore in your boat, and you not only you have to have a medical course that's provided by the government. I have no idea what the course has in it, but they give you a medical kit, or you purchase a medical kit so you can safely go offshore and legally go offshore. That's not true in the United States, and as far as I know, it's not really true for any of the countries in Europe.
Right. You mentioned a little bit about you being licensed by the U.S. Coast Guard. Talk to us and tell the viewers and the listeners at home, what do you mean by that? You're a physician and everything, but what does being licensed by the U.S. Coast Guard actually mean pertain to?
Well, there's a very old license that's been around for hundreds of years called a ship surgeon, and that's ships plural, not ships apostrophe, ship
Okay.
surgeon. And the like the mutiny on the Bounty was caused by the ship surgeon, who was an alcoholic. And, and there's been really good ship surgeons throughout history. In fact, some of our greatest physicians in history were basically ship surgeons. Hippocrates went to sea as a ship surgeon. Rome had amazing ship surgeons that went to sea. They were licensed by the government, and
Oh,
it was a
wow.
rate in the British Navy. You had two rates in the British Navy, both in merchant marine and the military. A surgeon's mate, who would be what we'd call an unlicensed or enlisted
Hmm.
man. Then you had a ship surgeon, who was one of the ship's officer. In fact,
Okay.
on the Bounty, there were only two officers on the Bounty. There was the Captain Bligh, and the only other officer on the ship was a guy named Thomas Huggin, who was a ship surgeon. He was totally incompetent. He was barely literate, and he was an alcoholic. And so when I got licensed as a ship surgeon, when I separated from the Navy, you had to
Hmm.
be separated from the Navy to be licensed as a ship surgeon by the Coast Guard. And I
Okay.
went down to take my paperwork in, and this was at the Coast Guard station, Alameda. And the gentleman behind the desk was an elderly man, probably in his 60s or 70s.
Hmm.
And he said, "There's no such thing as a licensed ship surgeon. That license has been gone for decades." I
Really?
said, "Yeah, there is." So he walks away and he comes back shaking his head and he goes, "Yeah, you're right. There is still a license as a ship surgeon, but I've been doing this for 40 years and I've never given this license." He says, "Do you have your paperwork?" And I said, "Yes." To be licensed as a ship surgeon by the United States Coast Guard in 1985, you had to have three things. You had to have an unlimited license in one of the 50 states to practice medicine, surgery, obstetrics, pediatrics, and
Hmm.
an unrestricted, unlimited medical license to practice medicine and surgery in one of the 50 states. I had a California medical license at the time.
Hmm.
And then you had to have a letter from a shipping company that says that they were going to hire you as a ship surgeon. And I had a letter from American President Lines. In fact, the vice
Wow.
president of the company was one of my patients. So I, I got a letter from them. And then the most important thing you had to have three notarized statements by licensed physicians stating that I was sober, because traditionally ship surgeons were alcoholics and drug addicts because they had access to the ship's opiate store, the ship's cocaine stores. And keep in
Hmm.
mind, cocaine,
Wow.
before it became a recreational drug, every medical officer, whether he was a country doctor or a ship
Hmm.
surgeon, carried cocaine in
Oh,
his
wow.
little black medical bag, because it had so many uses. You could operate on the eye, because cocaine would put the eye to sleep. You could operate
Oh,
on the nose with like a nasal fracture with
yeah.
cocaine, and it was part of every doctor's medical kit was cocaine. And then they had access to the ship's med, alcohol stores, because it was the medical officer of the ship that dispensed the daily grog rations to the sailors. So, and some of our most famous ship surgeon, Arthur Conan Doyle, who wrote all the Sherlock Holmes stories, he had been a
Hmm.
ship surgeon for
Wow.
7 years, he became addicted to both cocaine and opium as a ship
Oh,
surgeon. And
wow.
if you read the books, Sherlock Holmes, was often smoking opium and
Right.
doing cocaine. And there have been other ship surgeons in history that also became addicted. The Patrick O'Brien series about the commander, it was fought it was about a captain and his ship surgeon during the Napoleonic Wars, fictional. The ship surgeon
Yeah.
there became addicted to uh, opium. So you it was
My
important to get a
goodness.
license as a ship surgeon with the Coast Guard, that I have three other physicians that say that I'm sober. Now,
Right.
I did some research in 2010 to find out how many Coast Guard licensed ship surgeons were left. And in
Hmm.
2010, there were only three licensed Coast Guard ship surgeons around, and I was one of those three. And the other
Hmm.
two men were in their mid 70s in 2010. So I'm pretty sure I'm the only licensed by the United States Coast Guard ship surgeon in the
Yeah.
world.
Yeah. Unless, they're pushing 100 now. So who knows?
Right, and it's unlikely that they're doing podcasts and writing books, though.
Right, right, right. But one thing that I'm very curious about, Dr. Hill, is you're a physician. You have all these years of experience in the field, and it's probably because you were also in the Navy. But where does the passion come from? Because you know, being a physician is one thing, but it doesn't necessarily translate to the passion for maritime medicine, right? So where does that passion come from?
Well, in addition to teaching at the California Maritime Academy, I also had my own medical course. I taught a 2-week course primarily to merchant marine officers that were out in the field that needed to get continuing maritime education. And then there was a time when a lot of couples and families were buying large sailboats and going sailing around the world. And in
Mm,
addition to, they had to know how to work on their diesel engine. They had to understand electronics. They
right.
almost all of them got ham radio license, so they can communicate at sea. This was before we had, satellite phones and stuff.
Yeah.
And they also would run into medical problems. So there was a real need for people to learn about medical care at sea. And there was a period in my life for years I went around all over the country and gave lectures at the Safety at Sea seminars. The
Wow.
largest group I ever spoke to was at the Naval Academy. I believe it was like in 1997. At
Hmm.
the Naval Academy, was one of several speakers about safety at sea, and I was the talking about medical stuff because when you're in the when they're what I tell people in the book and at the beginning of every lecture, medical emergencies are extremely rare. Whether even in a hospital, I trained at the largest military hospital in the world in the early
Wow.
80s as a medical student intern, Naval Hospital San Diego. It was the busiest military hospital in the world at that time. And in the emergency
Hmm.
room, we saw about 250 people every 24 hours. We maybe
Wow.
saw one true medical emergency once a week in this
Okay.
busy hospital. So medical emergencies are at sea and in the field are rare, but there are no
Yeah.
emergency rooms at sea. So if you have a medical emergency at sea or on a backpacking trip, or let's say there's a massive earthquake, and I live
Yeah.
on the earthquake fault line in Northern California, there's a massive earthquake, the hospitals are going to be useless. You are going
Right.
to be on your own. And when there's an earthquake, there's going to be puncture wounds, there's going to be burns, there's going to be open fractures. And if you don't have the ability to have drinking water and food stores and some way to deal with medical problems, you could be in a bad way. Because
Hmm.
even I was a small town doctor for 30 years, and I've been retired now for 11 years. It used to be in my town, there was probably a dozen physicians in the area that had clinics. Those are all gone.
Hmm.
Medical care,
Oh
especially since
wow.
Obamacare, has been concentrated in the medical centers. There really aren't any
Hmm.
community medical clinics anymore. And after an earthquake or something like that, the hospitals, they're going to be pretty much useless if
Yeah.
the toilets aren't flushing. Once the toilets quit flushing, the hospitals are not going to be functional. They're going to be overwhelmed.
Right. That's so true. My goodness. So this book actually goes beyond maritime medicine. It's actually sort of like it helps these preppers too, right? Doomsday preppers and everything. Do you have
Absolutely.
people who reached out to you about that?
Well, in addition to teaching at the Maritime Academy, I founded the Osteopathic Wilderness Medical Society, and we did
Mm.
a meeting in Yosemite every year for 7 years. We did meetings in Alaska. We did meetings in the
Wow.
islands in the Caribbean, uh, teaching people how to practice medicine when there's no medical care.
Mm.
And really, it's not just knowledge. You have to have a medical kit. And one of the things the book points out in great detail is what
Mm.
you should have in a medical kit. And I used to tell people at the beginning of every class, and I talk about this in the book. If you could go back to 1941, December 7th in 1941, when Pearl Harbor was attacked, and you had this book, and you had a modern medicine chest that goes with this book, you would be one of the greatest physicians in the world. You could do things in 1941 that no doctor could do. They would be just
Right.
amazed at what you could do now with a medical kit that you could actually carry on your back. That
Right.
that you could. I mean, it's incredible the advances we've made in medicine. The simple thing is like a dipstick urine. When I started out
True.
in medicine in 1971, to do a urinalysis, you needed a centrifuge, you needed a microscope, You needed special dyes. You
Yeah.
needed a way to look at the hold up to a light and look at the hemoglobin. With a 10-stick urine stick, anyone that's not colorblind, you can diagnose a bladder infection. You can diagnose a kidney
Right.
stone. You can diagnose hepatitis. You can tell how dehydrated someone is. You can diagnose kidney disease. This, even in 1971, we couldn't even do that. And now with a dipstick urine, it's amazing how much information's in the patient's urine.
Right.
And with simple dips, that's just one example of what you can do with the power you have in a modern medicine chest.
That being said, because we were talking about modern medicine and everything, and understandably so, it took you several years to update and continuously keeping to update this book. How has this evolved from when you initially wrote Medicine at Sea, and how compared to now at its latest version, Dr. Hill?
Well, over that time, literally hundreds of people took my course and went to sea. And then they
Mhm.
came back and said, I really used a lot of this in your medical kit.
Awesome.
We needed more of this. I wish you had emphasized this particular problem more. And an example is
I
abdominal pain.
see.
Abdominal pain can be really scary. And
Mhm.
I've had people in the early say, well, maybe I should have my appendix removed before I go to sea so I don't get appendicitis. Well, this is another example
Oh,
of
wow.
if some in the field or on a ship, if someone gets abdominal pain and they have a fever, you start them on antibiotics. Much of the world
Mm.
treats appendicitis with antibiotics. If you start early with antibiotics, you don't need surgery. An example
Mm.
is the guy that wrote, years ago. There was a guy that wrote a book called Dove, and he was the 16-year-old that sailed around the world, the youngest person to sail around the world by himself. Well, the year before he did that, he was in the South Pacific cruising with his family, and he developed appendicitis. They didn't have any
Right.
antibiotics. By the time they got him to a hospital in Tahiti, they had to open him up. The appendix had ruptured, and he nearly died and had to have surgery. Had they had some antibiotics, it would have never happened. So one of the things that's really important to have in a modern medicine chest is antibiotics. And I have a strong feeling if someone in the field or at sea gets a fever, you start antibiotics. I did
Right.
3 months of tropical medicine in Egypt when I was a medical student, and one of
Wow.
the first days in the job, we listened to a presentation of like a 14-year-old Egyptian boy that had a fever of unknown origin. And it was, we had all the lab work and everything. And after the lecture, Captain Dempsey, who's a retired Navy captain, he was
Yeah.
my mentor. And we're leaving there, and he said, well, Dickie, what do you think? And I said, well, gosh, he's got this fever. It's lasted 2 or 3 weeks, and everything I did, really, lab work was normal. Perhaps he has like a lymphoma or something
Mhm.
else. And, he stopped me in the middle of the hall and kind of chewed me out. He said, listen, young man, we're in the tropics. The 10 most common causes of a fever in the tropic is infection, 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 infection. Forget all this stuff about lymphoma and autoimmune disease. When someone has a fever, it's an infection until proven otherwise. So I think if you have antibiotics and someone gets a fever, there's nothing wrong with starting antibiotics and then try to figure out what's going on.
Right. Wow. With that story you just mentioned, I bet it was difficult for you in the beginning. Practicing medicine on land is difficult in and of itself, but doing so when the ship is moving to and from or to and fro, swaying back and forth,
Right.
Your limited resources and everything. Talk to us about how your transition was during those early days, Dr. Hill.
Well, see, that's a very important point to make, and I make that as an important point in the book. A ship is really unique. Now, you can be isolated on a backpacking trip. You could be isolated on a climbing a mountain. You could be isolated in a mine where there's an injury. But in all those other cases, at least the platform is not moving. Now, a ship is really unusual because it is not only isolated, it's moving. So this changes a lot of things. Like if you had to take a foreign body out of the eye, now it's one thing to take a foreign body out of the eye when nothing's moving. But if you have a foreign body in the eye and you're on a moving platform, then it becomes a whole new game. So a ship is unique to any place in the world when it comes to being isolated in medicine, because you are not only isolated, the platform is moving. And if someone gets injured in a storm, now you've got a violently moving platform.
Right. And that being said, I wanted to ask you this because, with all this passion, all this knowledge that you've condensed into this book, what is the end goal like, Dr. Hill? Because when are you going to be able to actually just sit back and relax at home and tell yourself, okay, I've done my part, I did a good job? What's that end goal like?
Well, I think I'm already there, Michael. I just got back through spending 3 weeks in Nicaragua and Colombia. I was in Nicaragua and Colombia a few months ago. I've been retired now 11 years. I have been traveling for 11 years. I travel with a medical kit. I'm constantly learning new things about medicine. When I go to these countries, I'm interested in what they're doing for this or that. That if you look at the ship surgeons, another very interesting ship surgeon was Adolf Hitler's personal physician, a guy named Theo Morel. He had been a medical officer of the First World War, actually in the trenches, and he had, after the First World War ended, he became a ship medicine officer for years, and he went all over the world collecting different concepts about medicine. He would go into these foreign countries, these tropical medicines. So when he came back, it's really interesting. He came up with this concoction for Hitler. He was given he was given a lot of vitamin B12 shots and vitamin C shots, but towards the end, he was giving Hitler injections of opiates and methadone and
oh wow,
all kinds of things. He was bull serum, bull semen,
bull semen,
prostate things ground up, testicles ground up, even feces from Romanian peasants. Believe it or not, he was injecting Hitler. And he was towards the end. He was injecting Hitler maybe 8-10 IV injections every day, and he never washed his hands. He had dirty fingernails, and Hitler was really fastidious. He changed his shirt 2 or 3 times a day. He was a vegetarian, and yet he chose this doctor that never even washed his hands. And he addicted Hitler to methadone. He addicted him to methamphetamines. He was injecting him with like bull semen and ground up testicular tissue. So Hitler was getting basically testosterone among everything else. And of all things, feces from Romanian peasants. It's all in my book, by the way. I documented all this stuff.
Okay. Wow.
And so here was another ship surgeon, like the ship surgeon on the Mutiny on the Bounty that caused the most important mutiny in history. Ship surgeons have played a role in history, both good and bad.
It's so cool to me
I'm
because
playing a good role in history. The book is kind of it's my contribution to society. That's why I like to put it in all these medical schools. Hundreds and hundreds of people have taken my medical course, and I've heard from them where they've saved lives and they've saved limbs, and they've been able to do things in the field where there was no medical care, or they realized the medical care wherever they were in the third world was not as good as the medical care they provided based on my training and my medical kit.
Yeah. No, that's so true, Dr. Hill, because over here, let me talk about the Philippines really quick. And I think it's pretty much the same everywhere else too. Obviously, we have medical kits and boats and everything, or first aid kits rather. But I think it's different if a person on the ship or on the boat really does know what they're doing, because a simple cut on the forehead gets a lot worse when it's on, on a ship, on a boat, out at sea, And that being said, talking about the book a little bit now, what in your professional opinion, which part of the book or which particular condition, disease, or whatever it is, what terminology you want to use, what's the most complicated thing or the worst possible thing a person could actually get or face out at sea?
Well, when I do a brief talk, like at a yacht club or something, I'm
Mm,
asked to talk. There are two things that I emphasize. One is because of we're both men, we're
mm,
not spring chickens. Chest pain is chest pain can kill you. I
yeah.
mean, the heart attack is the number one killer in this country. And
Mm,
now you add all the type 2 diabetics we have and heart disease, strokes are even more common. So I talk about the management of chest pain in the field. Uh, if you have chest pain in the field and you have risk factors are, being a man, having testicles,
yeah.
being overweight, although just as many women die of heart attacks as men do, but it tends to, it seems like that we're more concerned about chest pain in men, but you have to be concerned about chest pain in women too. So,
Right.
but the thing about chest pain is you can't tell in the field if this is a heart attack or is it heartburn or is it chest wall. You can't tell that. So I tell people, if you have chest pain in the field and you have risk factors for heart disease, and the book goes into all these risk factors, and family history is really important. If a lot of your uncles and your father had heart attacks, then you probably have a high risk for that. But
Mm,
if you have chest pain in the field, one of the most important things you can do is have someone chew an aspirin. Chewing an aspirin is never going to cause any
mm,
harm, and it may save someone's life. And then if you have the ability to take a blood pressure and pulse, if the blood pressure and pulse are normal or elevated,
mm,
then you give them a drug called a beta blocker. And beta blockers block
right.
adrenaline, because what kills you in your heart attack is your own adrenaline. Because when you get chest pain, you get anxious, and the pain alone causes you to release adrenaline. And if you get anxious, you release more adrenaline. So having those two simple things, like I fly a lot around the world, and in,
Yeah.
in my carry-on baggage, I carry aspirin and a beta blocker. And there's been at least 3 times when I've been flying, especially on long flights,
Yeah.
where they ask if there was a doctor on the plane. And it's not always been, but 3 times it was chest pain in
Mm,
someone that had risk factors. And I administered, yeah, but they have to chew the aspirin. They can't swallow it. They have to chew it. Chewing an aspirin in the field is more effective than giving these clot-busting drugs in the
right.
emergency room, because you're not going to get the emergency room right away. And then giving someone a beta blocker. And then I've also responded to other things, someone with a fever, a child throwing up, abdominal pain. It's interesting. We know the pilots have told me that we know there's doctors on the planes, but hardly any time do we get a doctor that actually answers the call. So they're very
For
thankful I
real.
answer the call. And really, my expertise is field medicine. I mean, I was a
Mm.
family doctor, small town doctor after the Navy. I delivered my own children at home.
Oh,
I was one
wow.
of these doctors that did a little bit of everything. I did surgery, I did obstetrics, I did pediatrics,
Right.
I did internal medicine. When I trained, 50 years ago, doctors were first trained as kind of a jack of all trades, and then if you wanted to specialize, you specialized.
Mm,
But seemingly now, there's hardly any general practitioners around.
yeah.
Almost everyone's a specialist.
That's so true. That's so cool. This episode, just going to be very frank with you. I'm learning a lot, and I'm pretty sure the viewers and the listeners at home are learning a lot too. And I
And the
guess,
other thing besides
yeah.
Michael, and the other thing that I emphasize besides chest pain in the field is wound management.
Okay.
Wounds. I mean, if you look at some of our nursery rhyme, Snow White, a
Hmm.
prick from a bush or a sewing needle or something. There's different. It goes back to the 13th century, where a simple wound uh, can kill you. Because wounds will get infected. So I really teach wound care. A
Yeah.
simple wound can turn into a major thing unless you deal with it aggressively. And I
Right.
remember I was a submarine medical officer for a squadron of nuclear boats, and they all had corpsmen. The corpsmen all worked for me, and they all liked telling me everyone had tweak their own little medical kit on the nuclear
Hmm.
submarine. There was a standard medicine chest, but they all had some little thing. And like this one man told me, he said, "Listen, when I come on the boat, I go to tell every department, everyone on that boat understands. If you get something as simple as a paper cut, I want to see every single wounds. If
Oh,
your
wow.
skin is broken, I want to see every single wound on this boat. You bring it to me immediately. I will clean it, and I'll look at that wound every day for 3 or 4 days. And if the first sign of redness or swelling, I start antibiotics." So
Mm.
I've always remembered that there's no such thing as a simple wound in the field. And And even I made that mistake. My daughter got a new puppy, and the puppy, I got playing kind of rough with it, and it punctured my skin. I just ignored it. Lo and behold, 2 days later, I had a wound infection, and I'm an expert on this, and I didn't take care of the wound the way I told my students to take care of the wound.
It's funny that you say that, because over here, I'm just gonna tell you, over here in the Philippines, people don't actually go to see the doctor until it gets really, really bad. And I don't know if it's a financial thing over here. I don't know if it's just the way people are, but that's usually the case. So I'm pretty sure that your book serves a need outside of the U.S. Yeah, this is exactly why we're shooting this episode. Being near, because you mentioned it too. You're in the part of the world where there's a fault line. Us too over here. The Pacific Ring of Fire, and everything. So. Yeah. And that being said,
you have hurricanes, which wipes out your medical facilities right there.
Yeah, that's the scariest part, as you mentioned earlier, because once the toilets stop flushing, we're all screwed, basically, right? And I think that brings me to this question, and I think I want to end the show with this question, Dr. Hill, which might be a little difficult for you to do because you've given a lot of good advice already based on your book, but if you can, taking medicine at sea, right, as the context, if you could only give one piece of advice, what would it be?
I've really changed my mind about vaccinations. I really only recommend 2 vaccinations anymore, and that's a tetanus, because tetanus it's in the soil, it's everywhere. Mm. Tetanus has killed tens of thousands, hundreds of thousands of people from wounds, and the pneumonia shot, because the pneumonia shot not only protects you from pneumonia, but there's a thing called you've probably heard of the flesh-eating strep. These are wounds that get infected. The pneumonia shot also prevents that. So if you're going to travel, get a pneumonia shot, get a tetanus shot, take antibiotics with you. And my favorite antibiotic is Zithromax. There's no antibiotic like it. You take 1 pill a day for 3 days. It stays in your body for 2 weeks. So when I just came back from Colombia and Nicaragua, and I always bring back 200 or 300 Zithromaxes. But other antibiotics are useful too. Doxycycline is the drug of choice for tick bites, prevent Lyme disease. But you have to be careful. You don't want to get sunburn if you're taking doxycycline. If you get a toothache, amoxicillin's great. If you have to be on antibiotics for 3 or 4 weeks with a toothache till you can get to see a dentist, you can save that tooth with amoxicillin. And I actually put 4 different antibiotics in a medical kit, and I teach you when to use which antibiotic. But get those 2 vaccinations, and get some Zithromax, and always have a bottle of aspirin with you and Benadryl. If you're going to only have 4 drugs in a medicine chest, you have aspirin, you have Benadryl, you have Zithromax, and a stuff called Silvadene cream. It's silver and a sulfur drug, because that's something people. If you can only have 4 drugs, I would have those 4 drugs, and I'd get those 2 vaccinations.
Right. Wow. So before we actually end the show as well, Dr. Hill, please tell the folks at home where they can get a copy of Medicine at Sea, what forms they come in, it comes in, and all that stuff.
Okay, there's a brand new edition. There's editions since this one. I prefer you buy it from me. Amazon is terrible about paying, and they end up taking like 90%, it seems like. If you buy the book from me, you get a sign. I will sign it and personalize it to you. You can contact me through. We're going to have a web page. My phone number is 707-328-4884. I have my phone with me all the time, and I can get your address. Then I will arrange payment, and I will ship the book to you.
Awesome. And Dr. Hill, we can't say thank you enough for hopping and stepping into the scene with us today. Thank you so much for your time, sir. And
have a good day.
Yeah, to the folks at home, once again, thank you for stepping into the scene. I will see you in the next scene. Bye-bye.
All right.